Our next technique is needle cupping, and this combines both acupuncture and cupping into a simultaneous treatment. This is a medium to strong stimulation, and what you're going to do is grab your acupuncture needle, and you don't wear gloves whenever you're doing acupuncture, and make sure that your client's skin does not have oil in the particular area and that it's cleansed and you've swabbed it with alcohol. Now your client's skin is ready to insert the needle, so I'm going to go ahead and insert this needle directly here over the shoulder blade, and then place your needle at the appropriate depth into the muscle. And what we're going to do is place a cup over this needle. So you're going to want to select a tall enough cup that has clearance for this needle. So make sure that your cups aren't too tiny, too short, that they're going to hit the top of the needle. All right, so this is a medium to strong technique. So I have one single cotton ball here. We're going to for a medium to large flame. So introduce the flame into your cup and then immediately place the cup over your needle. What's going to happen is that the skin is drawn up into the cup with the needle directly over that skin. This is a strongly moving technique. So this disperses qi and blood. It also helps to dispel and draw out any exogenous factors in the skin. All right, so the mark here, we're going for a red to a dark purple mark. And just remember that because we have this needle, blood can be present. This range of application is for arthritic conditions, especially red, painful muscular areas, areas of muscle spasm or pain, sports injuries. And this is a really nice way to help to relieve focal pain, so someone can point to their pain with one finger. You also want to avoid needle cupping over the chest or any area where there might be any vital organs. So I'm doing cupping here right over the scapula, because sometimes what happens with this is that you put the cup over the needle, and because of the suction, it moves the skin, and that can move the tip of the needle. And so you don't want the tip of the needle to be pushed further into the skin or pushed into a vital organ. So here I'm over the scapula, I'm over bone. This is very safe, because if this needle were to continue to be pushed into the skin, it's just going to go into the scapula. Avoid needle cupping on the abdomen, avoid it anywhere on the body where you don't want the tip of the needle to penetrate further into the skin. I also avoid this type of treatment on people who are weak, frail, and on children of any age. The cup here can be left in place for up to 15 minutes. And what we're looking for is the skin in the cup to look very dark red or purple. So this is starting to look pretty dark red to me. So at this point, you just remove the cup, leave the needle in place. And this is a nice dark mark. And then you'd pull out your needle, and if there's any blood, just swab it with a cotton ball.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.